Good morning, everyone. Thank you so much for being here. We're just getting everything set up and appreciate your patience. Um, and again, we will start shortly. Thank you all for being here on time. Looks like everyone is here. Good morning. Welcome to quarter one Safe and Supportive Communities Action Team meeting. And we really appreciate all that is here. We have a pretty jam-packed agenda, so I will go ahead and get started. Next slide.
Good morning, Ted. This is Dennis.
All right, awesome. So just so a reminder for this meeting, it will be recorded. And please make sure to mute yourself, and also video is welcomed. If you do not want to put your video on due to recording, you are also welcome to do that as well. Again, my name is Robert Walker. I am a public health strategist with the City of Milwaukee Health Department, and I also lead in this action team. And so I'm going to go ahead and turn it over to Quinn as he continue on with our meeting presentation. Next slide.
Thank you for that, Robert. Good morning, everyone. We'll start off today with a mindfulness exercise that will be presented by Alana Taylor, who owns and manages Earth Angel LLC. Her email is there listed, earthangelstudios@gmail.com. That's earthangelstudios@gmail.com.
Good morning, everybody. I just want to express gratitude for sharing space with you all. I am able to take clients. If you were to go to earthangelstudio.com, you could easily book a 15-minute consultation just so that we could see what all you're looking for as far as mindfulness exercises, breath work, yoga.
Seems as if we might have some technical difficulties. Seems as if you froze, Alana. I don't know if you can hear me. Might need to reconnect.
I think she hopped off, so hopefully when she comes back on, it'll go a little smoother.
Give it a quick moment. In the meantime, I'll look for mindfulness exercise that I had available. Give me a moment. And we can just move forward. Hopefully she'll be able to log back on, and maybe we'll find time to do the mindfulness exercise. One of the reasons why we wanted to do the mindfulness exercise, just to focus a little bit on mental health, understanding, that the job that a lot of us do can be stressful. But just taking time out to focus on self-care making sure that we're all in a space to where we can give, but also receive. Hopefully when we, as we go through this slide and presentation, when we have a moment to reflect on Black authors, that will also give us a moment to have a self-care and a moment of reflection. Can we go back to the slides? Here's the agenda for today. Originally, we were hoping to have a mindfulness exercise, but like I said, we'll try to get back to that later on during the presentation. We'll do an introduction. So you can introduce who you are, what agency you're with in the chat. And then we break out into breakout groups. We'll have a more formal introduction of everyone. 10:45 to 11, we'll have the MKE Elevate updates and equity activity, followed by Sojourner Family Peace Center presentation. After that presentation, there will be some time for any questions. Next, it'll be the MKE Elevate 2024 Priorities Planning and Report Out. That's when we'll break out in our breakout sessions. That's when you'll have opportunity to introduce who you are to your group. And then we'll follow up with next steps and any questions. Next slide. But this is our shared agreements. This is agreements among our partners. Number one is step up and step back. If there's an area that you could be utilized to where you can add input or information, we really want our partners to step up and take the initiative without having to ask and pressure, but really just want people to step up and take charge. And the more that we do now, the less we'll have to do on the back end. Number two, respect each other's time. I think we just lost the slides. But number two,
Zoom just does not want me to be successful when it comes to sharing slides. I really apologize to everyone here. I do everything the same and Zoom trips it up on me. I don't know what Zoom wants from me. I should not have volunteered for this job, Robert. That's my bad.
No, that's all good. We're remaining patient with you. We'll get it figured out.
I just got another email at 10:30. That's the
There we go. Okay, so again, the shared agreements. Number two, respect each other's time and expertise. We understand we all have different backgrounds. We all bring a different level of expertise, but everyone here is valued. Number three, support each other's learning process. Four, elevate the expertise of lived experience. A lot of you may know of our MKE Promise Keepers and the success that they've been having navigating and connecting residents to resources. But one of their gifts and strengths is their learned and lived experiences of what they've been through, what they've learned from, and been able to pass that down to others in the neighborhoods and communities that they're from. So elevate the expertise of lived experience. Listen to understand and support. And number six, remember our North Star, the health of all people and neighborhoods in Milwaukee. We want to make sure that Milwaukee is thriving, is healthy, and vibrant. So that's our North Star. Next slide. And then I'll be passing it off to Robert.
Thanks, Quinn. Appreciate that. If we can go back to the purpose of today's meeting, thank you. For the purpose of today's meeting is to give an update regarding MKE Elevate. We will also explore how to infuse racial equity and increase community power building into MKE Elevate as a whole, but also specifically to our action team, and then share partner organization initiatives that align with MKE Elevate and the safe and supportive community goals. We will have a implementation partner highlight on today to share that. And then also at the end, we will have our prioritization of goals, objectives, and strategies for this year. Next slide. Okay, so this was the part where we were doing the icebreaker. So in the chat, if you can put your name, your affiliation, any pronouns, or any major updates that you may have. And then just if you could put what as the icebreaker question, what is your favorite Black author or influencer quote? So if you can put that in the chat and in our breakout rooms, we'll talk a little bit more about that as we continue to do this work. Next slide. So, for example, I wanted to share a quote from Martin Luther King Jr., which he said, "Commit yourself to the noble struggle for equal rights. You will make a greater person of yourself, a greater nation of your country, and a finer world to live in." So this is what we felt that would be a great asset to ignite what we're doing here at MKE Elevate, and how everyone can come and contribute to this space. All right, next slide. And now I'll pass it to Annika, which is my colleague, to talk more about the vision and mission of MKE Elevate.
Oh, you're on mute, Annika.
Thank you. Good morning, everybody. I was just saying that along with Alex, we are co-leading our overall process, and we worked with our steering committee to update our 5-year vision. So we have at least one steering committee member, David Fraser, is on with us today. So that updated vision is a Milwaukee where all people are thriving in safe, healthy, and equitable neighborhoods. And so we seek to accomplish this by aligning strategies, building power, partnerships, access to resources, and opportunities for collective advocacy in our 3 community identified priority areas. So that's safe and supportive communities, built environment, and maternal and child health. So looking forward to talking more about how we'll focus on aligning strategies for 2024 later on. Next slide. We did have a launch party in December. We had it over at No Studios. So we released our 5-year plan. You can find it online at milwaukee.gov/elevate. We did a storytelling activity. So we got some feedback from attendees on how they personally have been impacted by the priority areas. So for safe and supportive communities, people mentioned a lot of wonderful community organizations like UCC, Coral Central, Urban Underground. So safe spaces for underrepresented groups. We had some media coverage. So we had our health commissioner was interviewed, as you can see in the picture. So just a wonderful event. Thanks to everybody that joined us. And we look forward to continuing having general member meetings every June and every December. So hope that you can join us at the next one. Next slide. I'll pass it to Alex.
Great. As Annika said, my name is Alex, and I help co-lead MKE Elevate. So we really wanted to make sure that MKE Elevate is led with an anti-racist lens, and those who are implementation partners, that's also an agreement that we have in that space. So what does it mean to ensure an anti-racist lens is used? The first point is to understand personal privileges and biases. So really looking within yourself and understanding how your privileges and biases might affect how you show up in spaces. Identify opportunities to reduce racial disparities and health inequities across highest priority areas. And then the last one is a commitment to lifelong learning and developed shared language around racial inequality and health equity. So making sure that those 3 points are interwoven throughout MKE Elevate, our steering committee, and our action teams. Next slide. So we are going to do a equity activity, which is about power sharing and how the power that we hold as an identity and as an organization. So Melissa, if you let me share my screen. So for this activity, you will need your phone or a computer. And you are going to go to menti.com and then type in 86569408. I have to grab.
What?
Is anyone having any issues with? So if anyone's having issues, please let me know in the chat, and then somebody from our team can help out. So what we're going to do today is assessing our power. So even though we can't always see it, power operates everywhere at all times, even in this space that we are currently in. Power is not fixed, but is fluid. So the power that you hold in this space might be different than a power you might hold in another space, personally, professionally. And it depends on various factors and is relative to our space or community that we are in. So this activity that we're doing today is to help us consider how powerful we are as individuals and as your organizations you're representing, working towards system change and making Milwaukee a healthier place. So we are going to, this is just the first activity out of many. It's actually like a 5-step process. That'll take us a couple years to go through because this activity is meant to ease us into conversation about power. We're not going to leave this activity today having concrete solutions about power, but it'll help us expand how we understand and perceive power within ourselves. So this is a quote that power is the ability to achieve a purpose. Whether or not it is good depends on that purpose. So the couple benefits of assessing our power in this space is to help combat feelings of powerlessness by identifying what you have control over. It processes the paradox of feeling powerless within the system hierarchy while also having relative power within the community. It pulls back the veil on power structures impacting our work in this space. It helps us increase awareness of the responsibilities of having power and improve accountability. And lastly, it helps us identify ways to share your power with those who have been structurally blocked from the power due to their personal identities and lived experiences. So the first question I have for you guys today is, what are the benefits of accessing power in this space? So us collectively as an action team, what are the benefits of accessing our individual and organizational power? So Menti is an anonymous form. I can't see who is typing in the messages, which is how we would like it, just so people can feel comfortable sharing. So we have it's a safe space to start this convo. And if you're unable to do it on Menti, if you want to share in the chat, that's totally fine as well. You get a better understanding of your importance, equal ownership, a better understanding, transparency that distributes it, holding everyone accountable to assert or check one's power, knowing strength and weaknesses of the group, understanding where we might have leverage and influence within our groups. A lot of understanding. We have a just resource allocation. Again, understanding how interactions could be perceived, a voice to be heard in a safe space, inclusion, accountability, really great responses. We have 17 to add on to that list of 4 that we shared earlier. And so I think this shows collectively we see the importance of addressing power in this space today. So how powerful are you as an individual? So this is on a scale of 0 to 10, 0 being not very powerful, 10 being very powerful. So usually I get people like, well, what is it relative to? What do I factor in? It's however you're perceiving power in this space. Kind of like we said earlier, power is very fluid and that it changes. And so it's really however you want to identify your power right now in this moment. So we're seeing a lot on that heavier end. So with powerful groups so far, we have 1 at 3, a lot at 6, 7. Now we're kind of seeing a little bit more of a wider spread. No one really identifying as not power at all. We have 2 people with who express themselves as very powerful. We have 4 at 7. So I'm gonna give about 10 more seconds if people want to participate. All right, 7 is climbing. So as we can see in this space today, we have quite a powerful group of individuals that are collectively coming together to make Milwaukee a healthier place. So how did you decide where to place yourself? What are those factors? As I mentioned earlier, what were those factors that you were thinking about as you were placing yourself on the spectrum? Access, my involvement, energy, influence, resources, willpower, the power of will, influence. So seeing a lot about influences, the resources, how I control my actions and who I am, capacity, where the void was. I place myself low because I'm new to the group and movement, looking to learn more than anything at this time, experience in government, perceived place relative to folks sharing this space, my ability to move in a group, favor, race, education, organizational affiliation, subject matter expertise. So we're seeing that a lot is going into how we identified power in this group and how we're all kind of seeing power differently, or how we're powerful might be different based on somebody else's perception of power. So the next question I'm going to ask you guys is, how powerful are you based on your organization that you are currently representing in this space? So not you as an individual, but the organization that you're representing. And if you're not here as an organization, how powerful are you as a community member in this space? Right off the bat, we have a 6, 7, 3, 8. All right, so more in that middle area compared to individual. We have 110 now. 5 and 7 are right now the highest with 8. So 5, 7, 8. Give you guys 10 more seconds to kind of identify how powerful your organization is. 8 is 5. 8 was a common number in the individual power scale. All right. I see it slowing down on the responses. So the next question is, why did you decide to place your organization? So again, kind of that question about individual power and those factors. What are the factors that went into where you placed your organization? Whether, I've done this activity a handful of times now. Some people say funding, the resources they have, the trust they've built in the community, large system, authority and order, community influence, my organization's involvement, by the work we do in the community, influence in the community, years of existence, which is important. We've been around for 100 years, doing amazing work, access to resources, community influence. I'm gonna give about 10 more seconds if people want to add in their response. Our ability to change policy and obtain grant funding, influence, partner reach, institutional reputation with funders, and powerful entities versus reputation in community, which is a really good point. So how are we tying this in to the larger action team is, how do you think power imbalances show up in this group, right? We have to be able to identify them, to change them, and hold each other accountable. Because sometimes you might see something that's a power imbalance and another person might not. And so we really just want to open this up to a conversation for transparency and accountability. So us on the facilitator side can start figuring out ways that we can move forward with power, with no power imbalances, or at least be aware of them. So we have sphere of influence, the funding, so again, this question is relating to this space specifically. So if you've been to action team meetings before, there's no order. This one takes some time to think about those responses, so I'll give this one a little bit longer if you just need some time to think. So lack of momentum, lack of order, biases, funding resources, still or quiet voices, organization decision makers may not be present, involved, or aware, the way whiteness and dominant cultures define what we value, and how, I'm going to slaughter this word, so I apologize, vehemently we attack oppressive systems. All right, I'm going to give about 10 more seconds if you would like to participate in this question. Some think their voices still isn't important, lack of diversity. All right, we're going to move on to the next question. So one way to share power in this space is also to co-create solutions, specifically to the power imbalances that were addressed in that first screen, or even anything in this space. A part of sharing power is also sharing co-solution, co-ownership, things like that. So what are ways that we can share power and decision-making in this space collectively among all of us? Be resourceful, listen, share information, co-create decision-making, criteria and process, be engaged, employ diversity, equity, and inclusion, having a stake, being transparent, taking ownership, asking questions. So while people are still adding in their responses, again, this isn't just an end point. This isn't like an activity that we're going to do and then put in the closet and never acknowledge again, but this is a starting point that we're going to work with. So in our Q2 meeting, we'll be working together on creating those co-solutions. So A, we can hold each other accountable, and B, so we can share power and ownership in this group. So we are going to summarize and send out all these responses. The Menti is opened for 13 days after this presentation. If you still have some feedback, or maybe you saw a power imbalance in this group that you didn't identify previously. So yeah, that is my portion. Thank you all for participating. I will put the larger framework in the chat. It's from the MAP 2.0 Power Primer. Yeah, so that was my segment.
Thank you so much, Alex, for that presentation around equity and power priming. We're going to turn it over to Ellie as we go into our implementation partner highlight.
Good morning, everyone. My name is Ellie Freeman, and I'm the community co-chair for the Safe and Supportive Community Action Team here. So we actually have a member from one of our implementation partners. The implementation partner that we have here today is Sojourner Truth House. So just a little bit of history about Sojourner Truth House. It was founded in 1975 by a group of volunteers who rented a house with a goal to keep domestic violence survivors and their children safe. A few years later, in 1978, the vision expanded to advocate for survivors as they move through various systems on their healing journey. In December of 2015, Sojourner opened the Family Peace Center, which is a collaborative service delivery model to meet multiple needs of DV or domestic violence survivors in one place. So I will be introducing Tristan Gross. He's the Director of Partnerships and Community Engagement. And he's also worked to advance community well-being for the past 15 years in various capacities, including public health and violence prevention. Thank you so much for being here today, Tristan. I'll turn it over to you.
All right, thank you. Good morning. Good morning, everyone. Yeah, so I just one happy Black History Month, and February is also Teen Dating Violence Awareness Month. So I'll talk a little bit about that. Yep, so we'll hop right in. I do want to provide a trigger warning, right? I think with the prevalence of domestic violence and sexual assault and human trafficking that we see, that there are folks on the call who may have lived experience and do what it is you need to do to take care of yourself. But I just wanted to put that out there. We'll be talking about some of those things. So just generally, what is intimate partner violence? And I think this is going to be important as we start thinking about what it looks like for us to address this working community. So the World Health Organization, it defines it as any behavior that causes physical, psychological, or sexual harm to those in the relationship to establish power and control. So, right, and you see some of the categories that are included in that definition, but really it is this idea of power and control, right? I am using violence or the threat of violence to make you do what I want you to do. In Wisconsin, domestic violence is limited to behavior by an adult person against his or her spouse or former spouse against an adult with whom the person lives with or has lived with, or if they have a child in common. And I think it's really important to remember this because this is where the boyfriend or the dating loophole comes into play, that there are lots of folks who are experiencing intimate partner violence, domestic violence, who don't fall under the state statute of domestic violence. And therefore, those cases are not treated in the same way. So again, as we think about maybe some of the policy level work, let's think about how we can close that loophole. The dynamics of domestic violence. So right, the power and control wheel is a really foundational tool, and it talks about the various methods that someone who's causing harm to their intimate partner may some of the tactics that they may use, right? And then again, right, it is all about power and control there. So the isolation, the emotional abuse, the economic abuse, sexual, leveraging children, making threats, using male privilege, right? We know that domestic violence, gender-based violence is a function of sexism, and therefore male privilege plays a huge role. That's not to say that men can't be victims of domestic violence, but overwhelmingly what we see is that women and girls are. The other thing that gets really interesting there is how we talk about domestic violence within the gender binary. And I think it's important for us to expand our language or the way that we talk about domestic violence. But all in all, it comes down to this idea of power and control. Right. And then the cycle of violence. Right. So I know lots of times we look at folks in domestic violence situations and we ask, well, why don't people leave? And one of the reasons is because it's not bad for them all the time, right? That honeymoon phase or that courting phase, it actually provides person is extremely nice. They shower you with attention and gifts and all the things that you really want. And then that tension builds up over time. There's the explosion, and then they move back to the honeymoon period. And so when we're addressing domestic violence, to remember that this cycle happens, and it's all based on the denial, right? The denial or minimization of the harm that's being caused, mostly by the person who's causing the harm, but then also too sometimes by the person who is being harmed. And when we come to teens, when we talk about teens, the same thing is true, right? It's power and control. It looks a little bit different. So that's why they have specific power and control wheels for teens. And, I think teens are experiencing, teens have a different relationship to social media than some of us do as as adults or older folks. The minimization of young or puppy love, right? I think sometimes as adults, we don't see youth relationships as serious as we see adult relationships. And therefore we kind of minimize the behaviors and the harm that may be happening in those relationships. Oppressive behaviors and attitudes about youth. So even when we're in this creating a power dynamic where I'm the adult, you're the young person, I know everything, you know nothing, right? Not acknowledging the skills and talents of young people or the resilience of young people, and figuring out solutions for themselves. And just generally, I think some of the ways that we tend to deny the humanity and brilliance of young people um, plays a role into how we respond to teen dating violence. And then normalization of violence in home and community. I think one of the things that we really firmly believe here at Sojourner is that violence is a learned behavior, and it is very often learned and normalized within the home. And then sometimes, and then again, even in community. And so if the belief is that violence is just a normal part of a relationship, or violence is just a normal part of life, then it's more difficult for that young person to be able to identify that they should not be harmed in their intimate relationships. Some of the consequences. So there's clearly the physical health. There's the reproductive health. Again, as we start to think about policy and what's happening in the nation, what's happening in our state, ideas around reproductive health and how coercive reproductive health is used as a part of the power and control wheel, and that may be denying folks access to contraception. That may be forcing people to get pregnant. That may be forcing people to have an abortion, right? And there are lots of ways that reproductive health gets tied into intimate partner violence. Mental health and financial stability, and decreased financial stability are all um, uh, some negative consequences. One thing that I didn't put on here that's huge is intimate partner violence or domestic violence is a huge factor that contributes to housing instability. The damage to property, as well as multiple police calls to a home that gets it kind of the designation of a nuisance property, then creates housing instability for a survivor, as well as fleeing from harm. Here's some stuff we did. I encourage you all to look at the report that we released in partnership with the Kimball report, but with the Kimball Foundation. But the cost of domestic violence. So we really broke it down, right? When we talk about loss of life, when we talk about loss of productivity, we talk about physical health care, when we talk about the cost to respond to domestic violence, to charge domestic violence cases. In Milwaukee County, that number came to $113.1 million. So as we talk about resource allocation and how if we're doing really good prevention work, where else we could funnel those dollars to, this is also a really good thing to use with elected as you start to talk about budgets and to lift this issue up as an economic issue and not just a public health issue. Statewide, it is we see loss of life continuing to be the largest one, but it's around $657 million statewide that it costs the state to respond to domestic violence offenses. And in line with racial equity and looking at this issue through a lens of equity, like while we know that domestic violence can happen to anyone, domestic violence impacts Black women at a higher rate than any other group, right? They're 3 times more likely to be murdered by their intimate partner. They make up 14% of the population, but are 31% of IPV murder victims. And they just experience a higher prevalence than their counterparts of other racial and ethnic groups. So again, when we're thinking about solutions to domestic violence, those lived voices that we have to bring in, but also looking at the way institutional racism plays a role in the lives of Black women and what that means for their ability to get out of those relationships and to seek the help that they need. Some of those factors are distrust of systems. There's long history there, lots of reasons why Black folks don't trust systems, right? And that is also true in this the historical harm by the community, right? Looking at the first and second wave white feminism that very often required Black women to choose between being Black and being a woman, but then also didn't represent the reality of Black and brown women in the early women's movement. And then negative stereotypes, right? So the idea of the promiscuity of Black women, making them unrapeable, right? The incapable of feeling pain or having a higher pain tolerance. There's all sorts of studies there. And then the idea of someone being like Black, well, this is sometimes what we hear from law enforcement is the aggressiveness of a survivor. And you know, if somebody that you love and who claims to love you cause you harm, I think you have a right to be angry, right? But the way Black women's anger is interpreted very often leads them to not get access to the services that they need, and they often get criminalized for that or are seen less as a victim. Um, and so these are some of the things that they're dealing with. So strategies, we need culturally relevant programming, right? We need service providers who understand the reality of the of people who have lived experience, even outside of the intimate partner, the violence that they've experienced culturally. How are we connected? Of course, being trauma informed, building meaningful partnerships in community, um, general education and awareness building. And then I think more than anything, we need a place-based public health approach to dealing with intimate partner violence. What we see is that people are connected in communities, but we have to build those pathways from communities to services or build the capacity within communities to be able to respond to intimate partner violence. And you know, here at Sojourner, we do lots of things. We do provide advocacy. Help folks file restraining orders. We have the 24-hour hotline. We have our crisis shelter. The average stay at the shelter now is we bumped it up to about 120 days. I know that many of you know how dire our housing crisis is in Milwaukee right now, just like the availability of quality, affordable housing right now makes it really, really tough for us to get folks into stable housing when they come to us. We also do work with families through our child witness to domestic violence programming. We have a teen group. So those young people who may they don't necessarily have to be exposed to violence, but how we're trying to move a bit more toward prevention work. And then again, in the Family Peace Center, we have our 11 co-located partners who are also designed in there to meet other needs that families may present with. So resources in Milwaukee, right? A domestic violence survivor is 96% more likely to live if they talk to one person, right? Just talking to one person. And that one person does not have to be Sojourner. And this is not an exhaustive list. I think this was after I was doing some digging around. This was what I was able to put up, what I was able to bring up. But there are several DV organizations that are doing really great work. Lots of them are culturally relevant. Lots of them, excuse me, especially when we're thinking about the Hmong American Women's Association, the Latina Resource Center, the Milwaukee Muslim Women's Coalition. They do right. They can break down the language barrier that exists. Right. I mean, we have we have language services here, but you know, providing that service in real time in someone's native first language can be extremely helpful. Um, Hotlines, you know, Sojourner does not have the only hotline, a domestic violence focused hotline in the city. There are lots of other organizations who provide hotline services. Those are listed here, and then as well as shelters. We don't see as many shelters. The Pathfinders is specifically for young people, and I think that you know, again, with it being and Walker's Point Youth and Family Services have more youth focused services. again, our approach to domestic violence tends to be adult centric, but we're seeing rising rates of teen intimate partner violence now, and we need to do some work to support those young people as well. Some of the challenges that we see is the devaluing of culturally specific organizations as a function of systemic and institutional racism, right? And I think that has not given us that has not led to those organizations getting the respect or the funding that they deserve. Limited funding, I think lots of folks are seeing, funding dwindling down. Robert sent out a piece that we put out not too long ago about the upcoming VOCA cuts. This is going to be huge for lots and lots of the domestic violence organizations in the city, and at an area where we're going to have to get creative and innovative in how we continue to do our work. Meaningful partnership, it's hard, right? There's some historical harm that needs to be repaired. If we're going to come together and address this problem collaboratively, and that work, right, that work has to be done. And then data collection and analysis, right? Again, as I was going to try to find out like what's where and who's doing what, that information doesn't exist in one space. And you really have to work to put together comprehensive lists. But two, when we start to look at things like, when we put together the domestic violence homicide report, there's not one body or one entity that we can go to that holds that data or that collects data from various organizations that can say, okay, this person had touch points at these various agencies, or right, like I think, and that's a part of the collaboration and the lack of trust that makes it really difficult for us to put together the infrastructure to create a public health response to intimate partner violence. But as we just found out, we are a powerful group. And I really have faith that by talking about things really openly and honestly, that we can repair the harm, we can build the trust, and we can create a structure that really works for folks in the city of Milwaukee who are experiencing intimate partner. So thank you for your time. And if anybody has any questions, I'd be more than happy to answer.
All right, Tristan, are you able to put your contact information in the chat?
Yes.
Okay, thank you. That was very helpful. I'm a new social worker with the health department, so I am familiar with you all from past experience of volunteering. So you all do good work. Kudos. And yeah, I'll be take your information. Thank you.
Thank you so much, Tristan. There was one other comment or question in the chat where it was asked, will these slides be accessible to share? Okay.
Yeah, I can send that over. I can send those over.
Awesome. Or you can send it to me and I can just send it out to the group.
Sounds good.
Awesome. Awesome. All right. So we will go forward. If you do have any questions, feel free to put them in the chat for Tristan, or you can reach out to him via email. So we will continue on. If Melissa could put up the presentation slide, and Ellie, you can go right ahead with the strategy prioritization.
Which version of the slides are you guys seeing?
We're seeing the the presenter portion.
How about now?
Okay, great. That's perfect. And next slide. You can go. Yep. All right. Okay, Ellie, go right ahead.
All right, perfect. Thank you again, Tristan, for that information that you shared. All right, so we're going to move into the safe and supportive communities prioritization activity. So this is going to be unique in a way that we all pretty much are going to go into breakout rooms pretty soon. So we're just trying to break down the safe and supportive community action goals for the year. So keep in mind that the goals for safe and supportive communities involve interpersonal and intimate partner violence, crime and neighborhood safety, reckless driving and motor vehicle crashes, mental health, substance use prevention. And so what we're trying to do is identify like the objectives. We're going to vote on what objective from those goals that we want to focus on for the remainder of the year. And so this will be a time for us to kind of talk through. And it just brings us back to, you know, if it's something that you can take ownership of, to go ahead and step up and take ownership. If it's something that you or your organization is familiar with when we walk through these objectives for each goal. And that is what we're about to get ready and do.
Awesome, thank you. So
Mhm.
we're gonna pull up the Menti poll. Alex, could you share your screen with the Menti poll
Yep.
activity?
Sorry, I'm just getting it up. All right, so everyone, we are going to take our phones out again or do it on your computer. We love Mentimeter over here at the health department, and so I hope all of you guys do as well. So here you can scan this QR code, or you can type in, let me get the, it should be an option. I'm going to share it in the chat and then you guys can click on it as well. So scan the QR code, or you can participate by going to the invitation link. All right, is anyone having any issues with joining on? All right,
Also,
and then
Alex, let me just add this as well. So just to content for as we go through these goals, objectives, and strategies, we will be selecting one objective and one strategy today. We're voting on, and the strategies that will be present for each goal, it will be, as I put in the chat, the level of involvement. So these will be more so around how we are leading and participating, as we talked about in our last quarter meeting. And so those that we are monitoring will not be on the this prioritization activity, because other organizations will be working towards that, and we will be monitoring that. So just to put that in mind as well.
all right. So again, scan the QR code, or you can go to that menti.com. There is the code, which I'll put in the chat. So it's 23695919. There's a couple ways you guys can get to the Menti. Let's get started. So for the first prioritization is goal 1, which is based on the interpersonal and intimate partner violence prevention. The SMARTY goal identified is by 2028, we will increase efforts at the individual, relationship, community, and societal levels to prevent sexual and domestic violence before it occurs. The 2 strategies that we will be looking to prioritize for this year. So again, it doesn't mean that the other one will not be prioritized at all. It's a 5-year process. It's just saying we can only have so much space, time, and capacity. Let's just focus on one. So the first one is develop and implement an effective communication strategy, and 2 is to promote healing and restorative justice approach. So you guys can start with the voting. All right, so we're going to do a 10-second timer to get your guys' votes in. Because we are at a tie. Now it's looking like the first one. All right, responding is off. So for this year, we will be prioritizing for goal 1, develop and implement an effective communication strategy. Oh, where did my screen go? All right. So for goal 2, we'll be looking at crime and neighborhood safety. And the SMART goal identified is by 2028, we will support the increase of fostering safe neighborhoods. Here, we'll be voting on 2 prioritizations or strategies, which is the implement system level recommendations that move upstream of violent event. And then the second is to increase collaborations across organizations and sectors. And here, I will give a 30-second timer. Feel like I should have some like Jeopardy music or something in the silence. I say that every time I host a meeting. I should get my Spotify playlist in order for meeting silences. All right, so we got about 15 more seconds to respond, but it looks like it's apparent that the first one that we'll be prioritizing is to increase collaboration across organizations and sectors. So that is what we'll be prioritizing for goal 2, specifically crime and neighborhood safety. For goal 3, we are looking at reckless driving and motor vehicle crashes, that's a lot. By 2028, we will decrease risk factors for reckless driving. There's a handful of options for this one. So we have increased understanding of legislative requirements for driver education, support the City of Milwaukee's Vision Zero initiative, support Project Safe Driver, offer anger management workshops, focus on culture, social reasoning versus education, and address root causes and why teens engage. So again, I'm going to pop that 30-minute timer, 30-second timer on there. All right, got a little bit under 20 seconds to get your votes in. And again, this does not mean that the other ones go to the wayside. It just means for this year, we'll just be prioritizing the one. All right, we got about 10 more seconds to respond. But right now, the number 1 is addressing root causes and why teens engage. All right, 2 more seconds. So we will be prioritizing addressing root causes and why teens engage. Moving along to goal 4, which is mental health. So by 2028, we will improve availability and uptake of behavioral health services. Again, this one's going to have a couple of options. We have identify and increase accesses to resources, bridge gap between services and communities of color, increase school-based mental health, including student-led initiatives, increase after-school mental health support, increase mental health support for caregivers, mental health first aid, and expand violence prevention and intervention efforts in healthcare settings. So we'll get a 30-second timer. And then when we finish up this, we'll be going into breakout groups and there will be a facilitator in each room to kind of help us identify like, what does this mean? Why do we prioritize it? How do we move forward? So we have about 10 more seconds to get your responses in. So it looks like we'll be going with increased school-based mental health, including student-led initiatives. Thank you all for participating. So the final goal is goal 5, substance use prevention. And by 2028, we will promote efforts at the individual, community, and societal levels to increase harm reduction methods throughout the city. The ones that we'll be voting on is to plan an overdose prevention summit, host events, including International Overdose Awareness Day, to convene Milwaukee Community Collective, to promote substance misuse anti-stigma campaign, offer harm reduction trainings, maximize supply of overdose prevention and harm reduction tools. And then the last one is to provide coordinated communication about the supply and overdose prevention and harm reduction tools. So I'm going to put the timer on. 30 seconds. Nope. Not do that one. Sorry, I only gave 10 seconds on this one. I will redo it for another 10. Press C. All right, I think you guys are still able to add in, so I'll do another 10 more seconds. All right, so if you want to get your votes in, you've got 10 more seconds. It does look like the number 1 will be to provide coordinated communication about the supply and overdose prevention and harm reduction tools. Again, thank you all for participating in this. It's really helpful, but we all know what we're moving towards and working towards. So I'm going to pass it to Robert.
Awesome. Thank you all so much. Thank you, Alex, for facilitating that. And definitely excited about what we are moving towards for our next for next year. For this year, excuse me. Melissa, could you put up the screen for the presentation? All right. So next slide. So we're as stated going to go into our breakout session. And so each goal will have an action team work group. So the ones that we have selected has been noted and will be in those breakout sessions. And we will go over these questions as we are in those breakout groups. And so we will right now go right ahead and disperse you. You can choose which group you would like to select to be in. And then we will have a facilitator in those sessions. So go right ahead and make your decisions. And we will come back and report out. And we also have space for that as well.
Mm-hmm. And then Robert, do you want to hop into every group and just put the strategy? I don't know if there's a place we can grab the strategies that were selected.
I believe
I got goal 3.
Okay, I got goal 5. I just want to make sure everyone knows what goals. So to get to a group, you're going to go down and it should be on your lower right-hand side. There should be 3 dots. You would click that and it would say breakout rooms. And then there you'd be able, otherwise, if you're not, I can move you into a group. Yep.
So I'm hoping that the note takers have got the strategies. So if not,
Okay.
I can go into those and put the strategies in there.
Otherwise, I can put them in the chat real quick and I'll broadcast to everybody.
Okay, that'll be perfect.
I'll just have to hop on.
And Bethany, it will stay on. Okay.
All right. One is this. And I'll make sure I hop into the group.
Hey Robert, this is Justin. Did I miss the sorry, multitasking. Did I miss the link to the group?
No, we can get you into the group that you would like to go
Or
in.
I guess I have a high level question because I could actually prep for a noon meeting, but do how will next steps. It's basically everything that was just compiled in the Menti that we just did as a group process, which was great. How is that going to be? That'll be shared out with the full group afterwards.
Yes, it will.
My main question is I'm just really interested in the um I know this first step is just identifying those, but I'm interested in the measurement of them over time. Will that
Okay.
be the topic
Yes,
covered?
yes, we plan to cover that topic in our quarter 2 meeting to talk more about like how we will be measuring them and in our data inventory plan.
Got it. And then one last thing is I was just side texting or side chatting Tristan, but we're just getting year one of hospital level data on DV and IPV. And I was chatting Tristan around maybe figuring out how we can kind of at a community level try and track DV. It's complicated data, it's messy data, it's not representative of the true problem, but how can we do our best to maybe track at a community level? And I think we could further that conversation with the data he has and that we have as well.
Absolutely. I definitely encourage that. And let me know how I can be we can be able to help with supporting that.
No, I think the health department should be kind of the central place for it, and perhaps Sojourner and health systems and hospitals and other community-based organizations can be the ones providing the data inputs.
Hmm.
What I would gather, but let's
Yeah.
connect off on and offline if that works.
Oh, absolutely. Absolutely, Justin. Thank you.
Great. All right, I got to hop, but excellent call. Thanks so much.
Yep, no problem.
Yep.
Yep. All right, so let me get to the 3. All right, let me join here. I think I was in 3.
The time went fast.
No doubt. Yeah, I know we're coming close to the end of the meeting. I have to jump off and I apologize. I agreed to lead that and happy to do it. Can we talk offline at a later time to work out specifics?
Absolutely. Thank you, Chief Lipsky. Drive safe. Thank you for taking the time to jump on.
Oh, of
Definitely
course.
should focus on the road.
You guys are doing great work and we're happy to partner. Thank you. Bye.
All right. Awesome. Looks like everyone's coming back. Melissa, could you share your screen? So this will be as far as the presentation goes. So this is the part of reporting out. So I know we only have maybe about 4 minutes, so we can quickly have our note takers from breakout rooms 1, 2, 3, 4, and 5 to report out really quick.
I can go first from 5. I'm really excited. We had a really great conversation. So goal 5 was harm reduction, specifically the strategy to provide coordinated communication about the supply and overdose of prevention and harm reduction tools. And the group decided to create a communication plan for the supply and as well as the education on the supply regarding like vending machine, the suppliers, things like that. We'll be meeting on a monthly basis to progress the work forward. Yeah, so really excited. It's a really good group to work on this plan. It'll be an adaptation of the Red Book. So like how do we use kind of sources that are already out there?
Awesome. Thank you. Anyone else like to go ahead and report out?
I'll go. Let's see, this is Ellie. And we were with goal 1. It was myself and Tristan. So the goal is to go ahead and build out communication strategy regarding interpersonal violence with the community. So first, we would need to find out who our audience is, like who are we communicating with, so that we can go ahead and tailor a message based on that audience. From there, we will be able to go into next steps. Is it something where it's going to be like long-term or short-term? And that helps us determine like what type of resources we'll need, what other agencies we can partner with, what type of advertising we can do within the community. So we agreed to go ahead and meet monthly, standing meeting monthly, and then victory would look like just being able to identify a clear course as to what our next steps, the direction that the action team would be headed in for years to come. So that's what we have for now.
Awesome. Thank you so much. Anyone else? 2, 3, and 4.
I can read from the reckless driving group. Our Milwaukee County DOT partner was the only one to hop into that room. I think because everyone else on this action team is really interested in addressing reckless driving, but has other specific areas of expertise and focus for their individual work, which does make total sense. But we had a really good conversation. The DOT did some Safe Streets road shows last year where they actually got a lot of very similar feedback that this group has talked about. People are very concerned about the reckless driving. Why are people reckless driving? How can we get to the root cause of it? We didn't necessarily come to solutions, but there might be opportunities to there might be some openings in some groups that are working to address that coming down the line. So Robert is being plugged in to that line of information. And I just want to make sure that folks on this team know that violence prevention people should also feel empowered to, advise built environment folks, because it takes all kind. Jeff mentioned how it crosses courts, it crosses education, it crosses, family and community wellness. And that's what this group does too. So if you see those opportunities, go for it. We don't necessarily have next steps at this point, and so there's still a lot of potential if anyone in this group wants to rally around this and kind of keep it moving.
Awesome. Thank you. Last but not least, group 4.
Yeah, so we talked about the school-based mental health, including student-led initiatives. The group also agreed that they wanted to meet monthly. Some of the victory ideas they talked about is first forming a group with people from various sectors, so providers, advocates, building more collaboration, also focusing on educators, making sure educators feel equipped to manage mental health, starting early, so actually starting in preschool, teaching about mental health, and then also having a better understanding of how many teens might become part of a response team.
Awesome. Thank you so much. Appreciate all the report outs. We can go to the next steps. So next steps is we will at MKE Elevate, we will continue to have our conversations with our implementation partners and do some relationship building. We will also have our action team work groups developed and continue to have those conversations and gathering an action plan for these strategies. Then we will continue working on our data inventory plan. So be on the lookout for that as well. We will be reaching out to multiple implementation partners regarding data sharing. And then also we will, in the upcoming months, creating some training opportunities for this the action team, but also the other action teams as well. That is in MKE Elevate. And then lastly, we will be establishing some policy, data, and communication subcommittees. So if there's anyone interested, feel free to let me know or any of the co-chairs know, and we will plug you in. So next slide. Thank you, Melissa. So thank you. If you have any questions, feel free to send them to mkeelevate@milwaukee.gov. Our next Safe and Supportive Communities Action Team meeting will be May 21st at 10:30. We do have a meeting in evaluation, so feel free to click that link, or I will be sending up a follow-up email to make sure that you all do complete the evaluations and really be grateful for the opportunity to learn how we can get better in these meetings. And if anyone is interested in being an implementation partner, we also have a link for that as well. And we are still determining if for this next coming meeting, if it will be in person. I know we would love to be, together in person. So we'll definitely be in that eval too. So please select if you will be interested in doing an in-person meeting, or we'll continue to do the virtual meetings as well. Next slide.
I think that is the end.
Oh, awesome. Thank you all. Thank you all. Thank you all for coming and staying with us. And forgive us for the 3-minute overtime. So enjoy your day and go out and vote if you haven't. I know it's the election time for some folks. And so have a great, wonderful rest of the day.
Thank you, Robert.
Thank you.
Thank you. Thank you. Bye now.
Thank you, everyone.
Thank you,
Have a
everyone.
blessed day.
Just trying to unmute there. Right at the end there, were you seeing just like the slide fill the screen, or were you seeing like the PowerPoint side panel?
It was the PowerPoint slide panel.
It won't let me succeed every time. It is different. I found a little button to like, don't do presenter mode. And I'm like, perfect, that'll solve my problems. And it did not solve my problems. So don't use me next time. There's a reason. Oh, there's a reason I don't share slides.
Yeah, it's all right. That's how it goes sometimes. Yeah. So, yep, I think it was a great meeting.
Yeah,
we went
it was good.
definitely. Yep.
With 3 or 4 of the groups having like pretty concrete actions, that's impressive.
Absolutely. Absolutely.
Definitely good.
Thank you so much for all your help.
Yeah, no problem.
All right. Take care.